Okay, Mr. Shubhankar, we will start the program. Are you there? Shubhankar?
Yes, sir. We are live on YouTube, sir. We can start.
Okay. Good evening, everyone. Myself, Dr. Madan Kamble, Chairperson of Sexual Medicine Committee of Amogs, took this privilege to welcome you all for this very special episode of Sexual Health for All. This is the 7th episode, and we are so happy and lucky to have Association of IMA Maharashtra State with the permission and blessings of respected President IMA State, Dr. Santosh Kadam sir, and of course, Honorary Secretary IMAMS, Dr. Anil Awad sir, and our own Amogs office bearers, our dear dynamic Dr. Kiran Kurtkoti sir, who is the President Amogs, and Dr. Bipin Pandit sir, who is the Honorary Secretary of Amogs. I have my co-convener, Dr. Monica Murdan. She is a good friend of mine, zonal coordinator of Amogs and past chairperson of PSC committee of Amogs. I welcome today's chief guest, Dr. Kiran Kurtkoti sir, Dr. Santosh Kadam sir, guest of honor, Dr. Anil Awad sir, and Dr. Santosh Kulkarni sir. And today's speakers, Dr. Deepak Jomani sir, Dr. Jayarani Kamraj ma'am, and Dr. Supriya Arwari ma'am. I also welcome all the chairpersons of all the three sessions, Dr. Sumant Kulkarni sir, Dr. Sheetal Bhosle madam, Dr. Meenakshi Deshpande, Dr. Kiran Sonwalkar, Dr. Swapnanjali Awad madam, and Dr. Sneha Bhuyar madam. I welcome all, and I request all the respected dignitaries to join the e-lamp lighting. I welcome you all. Is it audible?
Yes, sir.
Yes. Yes. We will have this Amogs official song, which is the brainchild of Dr. Kiran Kurtkoti sir, President Amogs. I would like to play this song. This is official song of Amogs.
जय महाराष्ट्र माझा गरजा महाराष्ट्र माझा जय महाराष्ट्र माझा गरजा महाराष्ट्र माझा जय महाराष्ट्र माझा गरजा महाराष्ट्र माझा रेवा वरदा कृष्ण कोयना भद्रा गोदावरी वरदा कृष्ण कोयना भद्रा गोदावरी एकपणाचे भरती पाणी मातीच्या घागरी एकपणाचे भरती पाणी मातीच्या घागरी हिमथडीच्या तट्टानाया भीमथडीच्या तट्टानाया यमुनेचे पाणी पाजा महाराष्ट्र माझा जय महाराष्ट्र माझा गरजा महाराष्ट्र माझा गडगडणाऱ्या नभा भीतीन आम्हा तुझी मुळी ही गडगडणाऱ्या नभा आसमानाच्या सुलतानीला जबाब देती जिभा आसमानाच्या सुलतानीला जबाब देती जिभा सह्याद्रीचा सिंह गरजतो सह्याद्रीचा सिंह गरजतो शिवशंभू राजा दरी दरीतून नाद गुंजला महाराष्ट्र माझा जय 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 महाराष्ट्र माझा.
Thank you. As we know, sexual health is an integral part of everyone's life, and everyone should understand the paramount importance. We as a clinician are dealing with so many patients of sexual dysfunctions in day-to-day our clinical practice, and we should learn how to take the sexual history and which cases are to be referred to the sexual health expert. And the main aim of our Amogs Sexual Health Committee is to make create the awareness among all the doctors or gynecologists, so that they can percolate the message to the society and guide for the better sexual health of women and all. Now I welcome today's chief guest, Dr. Kiran Kurtkoti sir, who is the very dynamic and dear president of Amogs, very active and very supportive person. And he was the senior vice president of Amogs. I welcome
Thank
sir.
you. Madan, it's okay.
I welcome sir.
It's okay. Thank you. Thank you. On behalf of Amogs, I welcome you all. And today's chief guest also, Dr. Santosh Ji Kadam, president of the IMA. Today's guests of honor, Dr. Anil Avar and Dr. Santosh Kulkarni. Today's conveners, Dr. Madan, Dr. Monica, and of course, Dr. Deepak sir, and all the dignitaries. We have Suman, Dr. Rao, we also have Jairani, so Monica, and everyone. You know, traditionally we have been taught that in PSM, what is the definition of a good health? That is physical and mental well-being. But I think that the definition needs to be modified, and it has, and two factors should be added. One is the sexual well-being, and the second one, I don't know whether you all will agree with it or not, but the financial well-being. So these are the two well-beings which will keep you in the topmost sort of health category. And I would like to congratulate Madan for addressing the third leg of this health, that is the sexual health. And I also would like to thank IMA for being for joining with Amogs in this particular endeavor. And I hope, wish and pray, Madan, that this association with the IMA continues, because after all, it's our parent body with the largest. I think IMA is one of the largest organization all over the world of doctors, probably. So thank you, IMA, for being with us, and thank you, everyone. And I would request Madan to get on with the program. Thank you.
Thank you, sir, for your kind presence and kind blessings and the support as always. Yes, I welcome our next chief guest, Dr. Santosh Kadam, sir. No, sir is the currently president of IMA Maharashtra State. He is the past secretary and vice president of IMA Maharashtra State, and also he has headed the IMA Thane also. I welcome you, sir, and I also mention my special thanks allowing me to associate this activity with IMA Maharashtra State. Over to you, sir, for your kind blessings.
Thank you, Madindi. Good evening, and welcome you all, first of all, for this very important webinar conducted by Amogs Sexual Health Committee, chaired by Dr. Madan Kamble, Dr. I forgot her name, okay. And I think this activity was going on last year also under the chair of Dr. Revati Rane, and excellent topics were chosen that time also. I have attended few of the webinars. Today's topics are also very good. So I think in the audience we have Dr. Vin Pandit sir, Dr. Kiran Korthokotre, who is the chairman of Amogs, and Secretary of IMA Maharashtra State, Dr. Anil Awad, Dr. Santosh Kulkarni, who is the incoming president. I can see a big team of IMA also here, Dr. Sneha Buyar, Dr. Sneha Swapnanjali, and you have roped in the likes of Dr. Deepak Jumani as well as Dr. Supriya Arwari, very good topics. So, congratulate and best of luck for today's webinar. I will take a minute more. Uh, yes, IMA is the biggest organization, is the parent organization for all the associations in India for the doctors, for the modern medicine doctors. So I think everybody should become the member of this parent organization because we are fighting various issues through this body only. The rest of the body, I always say, these are for the academics. So all in all, Maharashtra Medical Council election is around the corner. It will be declared in next 2 to 3 days, and we always have a panel from Indian Medical Association. And if we choose all our doctors from Indian Medical Association, they always help our committee. We have witnessed when there was a PCP issue was going on 2 years back, and Dr. Bipin Pandit and we worked together and we try to help our fraternity. So one of the thing is MMC election will be around the corner, and you all have to gear up and see to it that all our good doctors are into the Maharashtra Medical Council. Along with that, now the new government has come up, and Health Minister Abhitkar has ordered the inspection of all the hospitals all over Maharashtra. I think it was very unnecessary. Today only I got an appointment for a meeting with him, and on 21st January we are meeting him, and we'll try to convince him that there is no need of inspection again. Every 3 yearly we go for the renewal, and that time the civil surgeons and MOH visit. So I think we all in all we are fighting on these various issues. And recently one circular also came regarding permission to the homeopathic doctors to use the modern medicines. And on that also we gave a representation. Recently we met FDA commissioner and convinced him, and all the documents has been given, and we are waiting for his reply. If they take back their order, otherwise we will challenge it in the court of law. So all in all, IMA is working for your betterment of for your rights, friends. With this, best of luck to this organizing team. Thank you. And Madan Bhau, we are going to come. You are going to come up with a new branch, Temburni, and
Yeah,
we'll be
yeah,
there with you.
yeah. Thank you, sir. Thank you for your kind cooperation and guidance as always. Thank you. At the same time, I would like to have some announcement, or as the Amogs has formed Maharashtra College of Obstetrics and Gynecology with the brainchild of Dr. Kiran Kurtukoti sir. We are very soon coming up with the certificate course of on sexual medicine very soon, and also we will have a big conference, national level conference by Amogs very soon, and we would like to associate with IMA Maharashtra State with the permission of President. Now I will hand over to Dr. Monica to welcome the guest of honors.
Thank you, Dr. Madan, for allowing me to be the co-convener for this program. I invite Dr. Anil Awad, sir, who is the Honorary Secretary of IMA Maharashtra State. Sir, it is an honor to have you with us because you're a grassroots worker of IMA.
Yes.
And he is a graduate of TNMC Hospital. He is a family physician since last 13 years, and he has been the Vice President and Joint Secretary of the IMA Maharashtra State. He's also received the IMA National President Appreciation Award for the Best Adjunct President of Local Branch in 2022 and 23, and a consecutive next year. He has also received the IMA Maharashtra State President Appreciation for Best Attendance in Office for the year 22-23. So it's an honor to have you with us and for your blessings, sir.
Yeah. Good evening, everyone. Sorry, I'm a bit traveling. I had gone to IMA Mumbai branch. We are having a state executive meeting on 2nd. So preparations are going on. Kadam sir is also there. First of all, thank you very much for inviting me for this very unique sort of webinar on sexual medicine. I think Sir Madan sir said, I think this is the seventh in a series from Amogs. Unfortunately, I have not attended a single one, but today I'm very much eager to attend this webinar. I'll be listening to what all the lectures throughout the session, definitely. And we have our own person, Dr. Jumani sir is there, and he's very good friend of mine. He's from our Mumbai branch also. So I'm eagerly waiting to listen to him again. And Dr. Santosh Kadam has already told you what IMA, is doing. It's a big body, and we are always fighting for the medical fraternity, be just physical violence or the issue of allopathy and homeopathy is going on, but we are always on our toes to fight all these problems. And I request all of you, if at all the MMC election comes, they are expected in few months. Do vote to IMA panel, because IMA is the one who will help you all throughout your the medical profession. And I request you to come and vote in a large numbers. Of course, I wish all the best for today's webinar, and hope we keep on getting invitations for such webinars in future also. Thanks a lot.
Thank you, sir, for your blessing. Can I request
Yes.
the next slide, man? Yeah. It is an honor and privilege to introduce our very own Dr. Santosh Kulkarni, sir, as a guest of honor. He has been an honorary executive member of the PCP-NDT working group.
Yes,
Part
madam.
of the INA headquarters, New Delhi. He has been the ex-joint secretary of INA Maharashtra State. And we know him so personally because he has been working in close connection with INA Solapur also, sir. So it is a grand welcome from our side, and we request you to please say a few words from your part, sir.
Hello.
Yes, sir.
Audible.
Thank you, Monica, madam. First of all, I would like to congratulate today's convener of webinar, Dr. Madan Kamble sir, who is the chairperson of Sexual Medicine Committee, and co-convener Dr. Monica Umbardan madam. And on the behalf of the IMA Maharashtra State, I would like to welcome today's eminent and very important speaker, that is Dr. Deepak Jumani sir, Dr. Supriya Arwari madam, Dr. Jairani madam, Kamraj madam, and actually Sexual Medicine Committee of Amogs, under the chairmanship of the Dr. Madan Kamble sir, is doing very excellent works in last 3 to 4 years. Not only they are educating all obstetric doctors for sexual health and sexual dysfunctions, but they are educating all the college and school students for sexual health. This is a big achievement of Sexual Medicine Committee of Amogs. And also I congratulate and welcome and thanks for better participation of and coordination between the IMA and Amogs. For that purpose, I congratulate and thanks for President Amogs, Dr. Kiran Kurti sir. And lastly, I thanks Amogs and webinar organizing committee for inviting me and giving my valuable guidance and suggestions, because today's topic is very important, because sexual health is directly or related to mental health. Because first topic is a couple counseling, because we are very much lagging behind in counseling during our practice. So Dr. Deepak Jomani's topic is very important, couple counseling. So thanks for today's webinar, for invitations, and again I congratulate Dr. Madan Kamble sir and Monica Umbardan madam. Thank you, madam.
Thank you, sir, and heartiest congratulations for being the president-elect for the next year for IMA.
Thank you,
and it is an honor to have both the president and the president-elect together on this platform, and it is this coalition or association will go a long way, sir, and we promise to associate with IMA in all the further webinars which we both of us conduct. Thank you so much for being there around.
Yes, thank you.
Can we start? Can we start with the academic
Yes.
session, Dr. Madan?
Yes, thank you, Santosh sir, for coming and taking your time. And always you are so cooperative at each and every step. And he's a very good friend of mine. Thank you. Thank you, sir.
Thank you, sir.
Yeah, let us go to the academic sessions. I also
The
welcome
first,
Dr. TSS Rao sir and Girish Mane sir here. Yes.
the first session is on couple counseling and sexual dysfunction with the speaker none other than Dr. Deepak Jomani sir himself. Our chairpersons for today's session are Dr. Sumant Kulkarni sir. He is a consultant at Swanand Nursing Home and he's received a Young Talent Award at Contact Device Siliguri AICOG. He's undergone training at various centers in laparoscopy, including the PG Pearls at Cochin. And he is currently the president of Neeraj OBGY Society. He has been the ex-assistant professor at VMMC Solapur. And he has been an undergraduate and postgraduate guide for MUHS exams. We welcome you, sir.
Thank you. Thank you very much for introducing, madam.
Our next chairperson is Dr. Sheetal Bhosle, madam. She's the director of Sri Chaitanya Hospital, Jalgaon. She has also done her international board for certified lactational professional course. She holds a fellowship in gynae endoscopy, and she's the honorary secretary of Jalgaon OBGY Society. She has conducted many training and awareness programs on breastfeeding and adolescent health. We welcome you, ma'am.
Thank you
I
so much,
request
ma'am. Thank you.
you to please chair the session and introduce our speaker, Dr. Deepak Jumani, sir.
Shall I introduce?
Yes, please.
It's my absolute honor to introduce Professor Dr. Deepak Jumani, sir. He's a senior sexual health physician and counselor. He's a diplomat American board certified clinical sexologist, fellow of American College of Sexology, asset certified sex therapist, honorable assistant professor at Sir JJ Group of Hospitals and Grand Government Medical College and Mumbai Hospital. He's a fellow of regenerative clinical medicine, course director and mentor, fellowship in clinical sexology. He's the editor of International Journal of Psychology and Counseling and co-chairman of IMA's Initiative for Sexual Health, Cybercrime Intervention Officer. I welcome you, sir, and really looking forward to your talk.
Thank you, Madan. Thank you, Sheetal. Thank you, IMA. Thank you, Amogs. Many couples find themselves grappling today with the complexities of being sexless in marriages. However, it is very crucial to recognize that a decrease in physical intimacy doesn't spell the end of a relationship. It's merely a part of the phase that many couples encounter in day-to-day life. But today we can explore effective strategies which we have to reignite the flame and strengthen our bonds. First and most important is we need to acknowledge and communicate the issue, because that's very important. And rather than remaining unsatisfied or frustrated, we shouldn't ignore the elephant in our bedroom. We should engage in open and honest communications. We as physicians should start a dialogue or initiate a dialogue to our patients by asking them very simple question that do you have problems in making love? To all those who are 30 and above, we need to understand that in every relationship, there is a conflict. There is no relationship which is without conflict. Learning how to handle your conflicts can not only patch up your issues, but also make your relationship much stronger. We should understand that every couple at certain time when they have sexual issues will need some help in navigating these relationship issues, regardless of whatever the issues may be. Maybe it is psychogenic, maybe it is organic, whatever it may be. This is where a couples therapy comes into play. Couples therapy offers an impartial, what it is. It is actually we become an impartial listener who can help improve the communication between both the partners. We see things from each other's perspective. We know where are the roadblocks and we try to resolve those roadblocks. it can also teach you to set boundaries, how to set boundaries and give you techniques, exercises, and certain tricks how to cope these issues in the bedroom. Because we know that there is treatment for every cause. Today, whatever is less in our body, we can say calcium is less, uric acid is less, vitamin D, B12 is less, we can increase it. Whatever is more, if your sugars are more, cholesterol is more, or pressures are more, we can bring it down. All those things are there. But medical management, though undeniably, is definitely important therapeutic intervention for certain sexual dysfunctions, but it does not serve as a stand-alone approach to treat many sexual dysfunctions, such as lack of interest, desired discrepancies, sexual performance anxiety, inability to reach orgasms, or early ejaculation. So many things which really need a certain amount of advice and counseling which is required. There are a lot of ways where we can do this. Without much ado, let me now begin my talk with pranams to God and thanks to my teachers, Dr. O.P. Kapoor, Dr. Prakash Kothari, Dr. Sashank Joshi. I beseech them to bless me always. All relationships go through hell, but real relationships get through it. Remember, real relationships aren't perfect, and perfect relationships aren't real. We all know about what is happening today. This is the wife of yesterday. Our parents used to get our daughters married in houses where the boy is earning, boys got good money, khate pite ghar ka hai, paise ka problem nahi hai. But today women are empowered. They are earning more and equal to men. Little are they bothered about the financial insecurities. So if they're not bothered about financial insecurities, we all can imagine what do they need. So this is the wife of yesterday who was subdued, who was under the dominance of a maid. This is the wife of today. She wants whatever she wants. And this will be the wife of future. A executive from bank with his wife, both of them came to my clinic about a week back. Both are educated, earning big fat salaries. The girl and the boy both walk in my chamber. They sit across my table. And the girl tells me straight away, after introducing, she tells me, Doc, he is not able to perform. Fix him or I shall leave him. This is the thing which she said, and she started to walk out. See how much stress she gave me, how much stress she must have given to her husband in the bedroom. You can imagine. Every wife today is a mistress for her husband, miss for 1 hour and the stress for the rest 23 hours. Our strongest need is pleasure, and the power to give pleasure is the greatest power we all have. Giving pleasure is a triumph of human spirit. James Prescott, who's a developmental neuropsychologist, says that our brain, he studied 44 cultures across the globe. And he said our brains have built-in reciprocal relationship between violence and pleasure. So if you want to decrease the violence in your surrounding, you need to increase your pleasure. And friends, intimacy is ageless. But to ignite intimacy, we need strategies of mind and body for optimum sexual pleasure. When you are married, wonders happen. But when you get erectile dysfunction or early ejaculations, you start wondering what happened. What men think they want and what women think they want. Let's unravel the blindfold. A woman wants one man to satisfy all her needs. And a man wants every woman to satisfy that little one need. There is quarrel if there is some misunderstanding, something happens between them. And today we see extramarital affairs and they remain sexless. They don't talk to each other, though they are newly married. Everything is fine anatomically, nothing wrong, but still they remain sexless. These certain issues like painful intercourse, dyspareunia, vaginismus, lack of libido, anorgasmia, erectile difficulties, premature delayed ejaculation, loss of desire, and all these things lead to something what we call it psychosomatic disorders. All these have got medical line of treatment, but they don't work if you don't counsel them very well, if you don't understand what is in their mind, what you don't tell them how to come out of it. So what is a psychosomatic disease? Psycho means mind, soma means water. body. It is known that psychosexual difficulties belong to a group of condition known as psychosomatic. When patients can't think or talk about their feelings, this is psycho. Their body expresses feelings of pain, fear, inadequacy, or resentment via a symptom. Colloquially, the body does the talking when the person cannot talk. Just like a child who cannot speak verbally but lets us know through his cry that something is wrong. This is what we need to understand. We need to understand the silence behind it. We need to understand the cry of this man, which is not seen as tears. We see youngsters getting abused, or so patients with history of vaginismus is a big example. Especially those who have not had therapy to deal with that abuse may present with sexual difficulties throughout their life. They may experience intense pain, guilt, fear, disgust, with some have difficulties becoming aroused, and so on. These victims of sexual abuse, in order to develop enjoyable adult sexual relationships, these survivors need to be able to differentiate between what is happening now by choice and what was happening then by coercion. They need to learn to feel good about their bodies and sexual feelings in spite of the abuse. They need to avoid sexual behaviors that undermine the healing process, especially obligatory sex. So, do drugs help us? Do drugs completely cure? When medications can improve a symptoms regardless of the cause, drugs do very little to boost self-confidence or improve relationships. Furthermore, drugs are not always effective. We have 50% patients who don't respond to PD5 inhibitors. If the patient is a part of a couple, both partners should be invited to discuss treatment options because both are affected. Sexual symptoms can be confusing. These symptoms are, anywhere in the body and can be a result of maybe medication or particular disease, but it is often due to dis-ease caused by painful feelings about sex or reflecting difficulties between the partners. So this is what we need to understand. Now, beautiful studies said that traditional culture affects the patient's sexual concepts, and they think that sex is a very private topic. Hence, when they experience the problem, they avoid talking about it, which aggravates the sexual, physiological, and psychological issues. These, in turn, affect the sexual experience of the patients. Therefore, to improve patients' sexual experience, intervention has to be there from multiple perspectives. It does affect the individual, it does affect the partner, and there is definitely a dent in the relationships. So what do? We all should understand the woman may have a menopause or the husband may have an andropause. Both do, but during sexual dysfunctions or whenever they are not able to perform or when they don't want to perform with the fear or ignorance, it's called couple pause. So couples need to be counseled. No counseling is complete when you do not counsel both the partners for any issues which are there between them. Reasons why there is reluctance from patients is they feel ashamed to talk about it, they feel embarrassed, they believe that the problem is a part of age, illness, or some medications, they feel distressed or disgusted by their body, they are unaware that the treatment is possible, they are sensitive to doctors' reluctance to talk to them about sexual difficulties. And reasons for reluctance to discuss sexual difficulties by doctors: sexual history was not included in the traditional medical history. Hutchinson doesn't mention about it. Little knowledge about sexuality and sexual difficulties are taught in medical school. About certain sexual issues and treatment possibilities, is not taught about it. There is lack of time. My friend, my teacher says, Deepak, I see about 100 patients a day. How am I going to ask all these things? I say, sir, you don't see 100 patients a day. 100 patients see you and go. It's not, you cannot complete your complete examination without asking about all these. Say, worry about the offending the patient, stereotyping and all that. There are lingering concerns. Couple communication is absent. They don't understand how to talk about it. There are negative attitudes towards sex. There are negative attitude towards each other. There are inaccurate beliefs about sex. And of course, they have comorbid conditions, maybe diabetes, maybe hypertension, maybe arthritis or so all these things, these patients need couple therapy. So what is it? Why do you need? Because we want to see every couple to be happy. And how do you see that this couple is happy? There is a foundation of affection and friendship. There is ability to resolve disagreements. There is positive sentiment override. 5-1 or better complement criticism ratio. Criticism has to be very, very little. Every time it should be compliment. Nothing goes wrong. Amount of conflict relatively unimportant. So what is couples therapy? In couples therapy, a licensed counselor works with two people to improve their relationship. Certain types of counselors are also specifically trained to work with couples, including marriage and family. So it does not have to be a guided practice reserved for any type of person. Couples therapy can help anyone in a relationship, regardless of wherever he's staying, like any orientation of any age. Couples can form a more secure bond with one another and be able to have vulnerable conversations without pushing the other persons away. This is what is important. And there are certain principles. You need to understand we need to change the views of the relation. We need to modify dysfunctional behavior with there. We need to decrease the emotional avoidance. Many men, they have psychogenic erectile dysfunctions, but they avoid having sex because they don't want to get confronted. They want to, again, don't want to face a failure. But doing that, they're depriving their partners of the love and the affection and the sex which she deserves. So this is what it is, So they develop an avoidant behavior. So we need to counsel them. We need to improve their communications, and this promotes strengths in them. The duration can be anything from 1 to 3 sessions or maybe 12 to 24 sessions, which we have. Research of couples therapy shows that in phase one, which was between 1930 and 1974, a technique which has little data now, 75 to 90, there was irrational behavior, which was corrected, exuberance, which was corrected. In 1990, we need caution and extension, and we need to be concerned about each and every aspect of his feeling and emotions. Reasons you may need couple therapies: when it comes to committing to couples therapy, partners can start therapy for any reason that causing conflict, distress, or mistrust. Couples may seek therapy to rebuild trust after infidelity or deceit, enhance physical or emotional intimacy, go through a transition together, like parenthood or a big. Once she gets pregnant, her erotic focus is not there. She's not interested in. But then we need to understand, the partner should understand, navigate conflicting views on how to parent, help manage substance use disorder or anything else. Reasons you may need: you need to understand more about your relationship, gain stability when feeling lost in the businesses of life, get support when there is grievances or any loss, have fun within your relationship and reignite your spark, resolve conflict and work through infertility, navigate career pressures, handle financial problems. There are four horsemen, which beautifully said by Apocalypse: criticism, contempt, defensiveness, and stonewalling. These needs to be avoided completely. When you assess the marital distress, distressed couples show high rates of these four horsemen in them: defensiveness, criticism, contempt, and stonewalling. First, understand the characteristic of unsatisfied couple, then prevent and treat dissatisfaction. Couples can be assessed by behavior cognition, body language, and internal dynamics. We need to help partners negotiate their behavior, teach more communication skills. A good counselor, a good couple therapist has to have the highest knowledge of how to listen well. Avoid four horsemen and other forms of destructive fighting. Focus on and encourage positive sentiment override. Continue improving communication skills and reboot your psyche. All these things, what we do, we reboot their mind, thoughts, feelings, actions, behaviors, etc. Can couples therapy make things as, if they are not committed, if they do not will it, it will not work. Couples therapy is not a tool for forcing your partner to change. You cannot force them. You need to give them options. You need to give them a menu of options, which is good for them from your experiences, from your understanding of the whole subject. It's meant to open up communications and work through issues. Lots of treatment approaches: behavioral, marital, couple therapy. These theory origins in behaviorism and is rooted in social learning theory and behavior. The purpose of behavior couple therapy is to build support for abstinence and to improve relationship functioning among married or cohabiting individuals seeking help from alcoholism or drug abuse. Integrative behavior couple therapy, there are two phases: evaluation, active treatment. The typical course takes about 6 to 12 months. Emotion focused therapy, couples and marriage counseling, couple counseling. There are various techniques. Each is a lecture by itself: Gottman method, narrative therapy, emotive focus couple therapy, positive psycho imago relations, Gottman therapy. I won't go into the detail, but most of these we need to understand. The basic thing is we need to acknowledge that each partner is communicating differently. This helps in resolving the problem. Partners learn that disagreements aren't signs of love loss. When you disagree, doesn't mean that you don't love each other. but are normal occurrences in relationship that can be resolved through communications. We need to understand the inability to communicate in healthy ways is the basis of for majority of the problem, because they react, they become judgmental. It's important for you to speak your mind rather than to expect one another to read moods and body language which are open to misinterpretations. A therapist like us can guide you towards functional forms of communication that alleviate misunderstanding. The purpose is to bring the unconscious root of a problem to the surface, whether the problem belongs to one male or a female. The belief of a psychodynamic counselor is that significant life events and childhood experiences shape people's behavior. It's the so many of gays, we know why they became gay, how it is. There is no gay gene as such, but it is the environment which has shaped them up what they are today. During couple counseling, the therapist explores major past experience in order to change distorted perceptions and eliminate irrational reactions to current events. Couple therapy isn't limited to deflecting or solving problems. It also promotes closeness and intimacy. When you go very near to understanding the problems with your clients, they will feel how doctor is understanding, how understanding is, and they realize where they were wrong. We help enrich their lives by adding the development of friendship and ways to show affection. By providing certain exercises and increase mutual support, we teach couples how to overcome the existing issues and how to make relationship resilient. There are three beautiful questions which I have learned. I ask every couple when they come for couple counseling. Imagine that you and your partner have successfully resolved the ongoing conflict that has been causing tension in your relationship. How would your communication and interaction be different in this ideal scenario which is there now? That was the first type. Second type of question: picture a future where both feel deeply connected and supported in your relationships. What specific actions or behaviors would you notice yourself engaging in to create and maintain that sense of connection? So you are giving them or trying to make them curious or increase their creativity for their future, maintaining the relationships. Lastly, if you woke up tomorrow and all the barriers preventing you from achieving your shared goals as a couple were magically removed, what steps would you take together to start making progress towards your goal? These are beautiful wonder questions which I have. This is a beautiful kiss of Ritik Roshan and Aishwarya Rai. Why I'm showing you this? Because basically the issue is low desire. And there is a new drug called Kisspeptin. Now, Kisspeptin is a wonderful drug which can be given to male as well as a female who have got hypoactive sexual desire disorders. Enough studies to prove that. I'm waiting for this drug to come so that I can give it to every couple of mine. So in men having hypoactive sexual desire disorders and in women also having, this can be easily given. Neuroimaging studies have proven all this. Now, we know older people, when they have new relationship, often are very actively involved in sex, whereas when they with their partners they are not, they are got married, just as younger people in new relations. So what does this tell us? Imagine, what does this tell us? It tells us that the it's the interest and not age that's important. So that's what is important to understand. Wrinkles don't hurt. For a conjugal life, constant connect is a must. There are a lot of alternate ways to get joy, several different positions, and in spite of vaginal intercourse, sexual activity in pregnancy, masturbation, massage, oral foreplay, mutual caressing, all other alternate forms can be. Look at her inner beauty. She is wonderful. She's given you a baby. She's given you all the joys what you need. Don't change her. Change yourself if you want to. Bring in variety. Sex is nothing. Pen is going into the vagina, but initiate in a very different form. Husbands watch porn, wives work in the kitchen. What is the signal the husband is giving to the wife? He's giving her a signal that you like the girl in the movie more than her. That's not correct. We should not do. Watch porn together. Get excited. And the husband and the wife's husband should criticize the girl in the movie. Men don't have any concept of afterplay. They ejaculate, they turn themselves on the other side, and that's it. Finish. They use their partners like a sleeping pill. What is afterplay? Afterplay is nothing but when you ejaculate, you must hold your partner tight, hug her, thank her, compliment her, tell her she was beautiful, she was awesome, and do everything what you did during foreplay again. That's important. Because if you see a girl who's done a lot of makeover and looks very good, anybody would say, oh, she's gorgeous. But if you compliment your partner in the bedroom, you give her a signal that you like her the way she is, and that speaks miles. That's an incentive for her to come again and give herself completely to you. My take home message is, friends, the onus of sexual health of your clients lies with you physicians. You have to come out of your clinical inertia and ask your patients, do you have problems in making love? Patients may not ask you, but you have to ask. Commitment gets the most mileage, marriage mileage. You need to be committed. Love each other and my 2 more minutes, sir. You need to increase your romance. There is no GST on romance. Please bring in harmony. These women were abandoned by their husbands. They got a makeover done. So they were admired. So my appeal to all the ladies is spend your husband's money as much as you can. Do go to the best of the parlor, wear the best of the lingerie, wear the best of the dress. Try and look as beautiful and as sexy as possible, and try to make your husbands jealous. Men will always be men. Monogamous marriage is like a garden, and polygamous marriage is like a jungle. Both are beautiful. But for a garden to make it look beautiful, you need to cut the right type of grass, put water, put fertilizer. So you need to devote time. So it's beautifully said. Marriage is like a beautiful garden. It requires skill and constant attention. If tended to, it will thrive, but if neglected, it will wither and die. So Voltaire beautifully said, try and cultivate your own garden. Friends, we are all born out of love and sex. We need to admire every woman. We are born out of her. So feminism needs to be admired, adored, trusted, and respected. If a man who doesn't adore, admire, trust, and respect feminism, I pray to God that he should get permanent, incurable erectile dysfunction. Love is a flow, it's creative. My last slide. That is why it flows and brings contentment. See, it's the attachment, it is the belonging, it is giving each other, it is sharing each other. This contentment is much more deeper and valuable than contentment with after sex. One who knows this contentment will never look for any substitute. Just like a person who acquires jewels will never look for pebbles or stones. Children should be taught to love from infancy. The myth that teaching of love will lead the child into the world of sex is fruitless, is groundless. You're not giving your child the permission to have sex. You're giving her the options, giving him all the choices, all the things what he can do and what he shouldn't do. The more love grows in a person, the more sex energy is transformed into sex and is shared. The less love filled in a person, the more sex-minded, more hatred the person has, the more jealousy, competitiveness, worry, and unhappiness will be there in his life. So behind every sexless marriage are reasons that extend beyond the bedroom. Identifying these can be the key to finding a solution. There is emotional discontent, health-related issues, stress, the frantic pace of life, especially in the metropolis like our country, New York, etc. They contribute to exhaustion and decreased interest in sex. Rekindling the connection beyond physically intimacy, sexual intimacy is just one facet of, it's a part of quality of life. Strengthening our emotional connections can often lead to more fulfilling sexual relationships. Spend quality time together. Show affections outside the bedroom. Also, hugs, kisses, compliments, nurture closeness. This is what we should make our clients aware of, all these nuances, and this can be done through counseling the couple, not just the individual. I've heard enough now. Now, please stop. So I conclude by saying couple therapy helps in understanding of different needs during in a married life and requisites, and tries to solve our problems through different techniques. It also allows in establishing intimacy and care amongst the partners. Thank you all for your love. I'll be happy to answer any questions you all have.
Sir, it was an elaborate talk. I request Dr. Suman Kulkarni, sir, to please give his expert comments.
Very nicely explained topic, Dr. Deepak Jumani sir. I think during our academic training programs, we were used to take the history of the patient in menstrual histories and obstetric histories. We were not trained to take the sexual history. But now we are realizing that when we are in current practice, we have to take the sexual history of the patient as well. Nowadays, because of the increasing stress and working odd hours of the couples, there's a lack of sexual interest among the couples that we're realizing. There's a change in lifestyle also because these couples are working on Monday to Friday and they're going to pubs with fast food on Saturday and Sundays. And they're getting engaged in some ugly clips on the mobiles. And they are not having sexual interest also. We need to advise these couples that they should look attractive to each other, because we commonly come across these IT public when they step into our consulting rooms. Both of them are looking so ugly, fatty, and putting certain odd type of dresses. I think everybody must be getting this experience. I advise them that at least both of you should go to a gym activity regularly together. Go for free workout in the grounds. Not only that, but go to some activity like a Zumba dance, as myself and my wife are doing. And we are getting a very good results of that. We are getting some funny examples also. A couple came to my OPD for her some gynec problem. She has delivered a female, a girl, baby girl, 3 years old. While asking her the history, what contraceptive method she's using, she gives some funny answer to me. Doctor, I have got a baby of 3 years old and that's finished now. And since the baby, we don't have a sexual intercourse for a day. So this is the reality. So I think what the topic sir has explained, I think this should be a counseling part in our clinical practice day to day, because we're getting these problems also. Thank you, Madan sir and Umadan madam, for involving me in this particular Amogs sexual conference, and to be a part of the galaxy of speakers, Dr. Deepak Jumani sir, Dr. Avari ma'am, and Dr. Jairani Kamraj, and of course, our dynamic president, Dr. Kiran Kurtikoti sir, Dr. Ajay Mane, and Dr. Santosh Kulkarni. Thank you. Thank you so much.
Thank you, sir. Thank you.
Thank you. Sheetal ma'am, do you want to say something?
थँक्यू सर. जुमानी सर, तुम्ही खूपच छान प्रकारे आम्हाला टिप्स पण दिलेल्या आहेत. आय एम नॉट अन एक्सपर्ट इन दिस सब्जेक्ट, बट आय वुड लाईक टू अप्रिशिएट अँड रिस्पेक्ट युअर नॉलेज अँड पॅशन अबाउट द सब्जेक्ट. And definitely it's time to include this sexual history in our regular history while taking the history of any gynec patient. Thank you so much. Thank you so much for inviting me, Madan Kamble sir, Monica ma'am. Thank you so much.
Thank you, madam. Thank you, Jumani sir.
Thank you, Deepak sir, for joining us today, and thank you, Dr. Suman sir and Sheetal ma'am, for chairing the session. We now move forward for the second session. Chairpersons for the session, Dr. Meenakshi Deshpande, madam.
I think, has she joined?
Yeah, I'm here.
I can't see. Yes, ma'am.
I'm here.
Yeah, ma'am is there.
Ma'am is the Secretary General of the Pune OBGY Society, a senior consultant. She had passed LLB in the first class. She has been the past president of IME Pune in 2022 to 23. And she's been practicing since last 30 years with a special interest in high-risk pregnancy. She's a director at Vatsalya Hospital and recipient of IMA Headquarters Dr. Kanak Goyal Awards in 2018, the Apulki Award, the IMA National and Maharashtra State President's Appreciation Award, and the Rotary Award for Outstanding Social Work. We welcome you, ma'am, as a chairperson. Dr. Kiran Somnalkar, sir, is the secretary of the Satara OBGY Society. He is an active member of the FOXY MTP Committee, past member of FOXY Ethical and Medical Legal Committee, the Amogs Yuva Coordinator, and he has also worked as a PCP entity medical officer in the Satara district. Meenakshi ma'am and Kiran sir, there's a change in the schedule, and Dr. Supriya Arwari madam will be speaking on teenage pregnancy. So I request you to please introduce Supriya ma'am first.
Okay. So very glad to
Yes, ma'am.
introduce Supriya Arwari. She's a good friend of mine, and she's a consultant obstetrician gynecologist from Thane. Recently, I think she has received a best prize for the Thane team, and kudos to you and your team for your performance in AICOG. So that was a very nice performance.
Thank you.
National Coordinator FOXY of Adolescent Health Committee. She's Vice President of Thane OBGY Society, Joint Secretary of Association of Medical Consultants, Convener of IMA Maharashtra State Women's Doctors Wing.
I think we can go ahead, Meenakshi. Thank
Person
you
of
so much.
Amogs project. We can go again and again.
Yeah, I think we can go straight away. At the
Can
outset,
go to
I
your
would like to
topic, yes.
thank first and foremost Dr. Jairani, who was actually scheduled for the second talk, for allowing me to go ahead because I have some commitments for later on. And after Dr. Jumani's talk, this is a huge responsibility for me to, carry forward the scientific program. I would also like to thank Madan Kamble and Monica, IMA team, Amogs team, and all the chairpersons and dignitaries that are there. I can see Kutte sir is still there. So thank you all of you for the
And
opportunity.
actually, I would also like to thank, our team of Amogs for combining it with IMA Maharashtra State Women's Health.
Absolutely.
Because women's health is a, common topic for both
Common,
of
yes,
us.
it's a common topic of interest for all of us, and at our heart, we all want that, our women should be in the best of health.
Correct.
So I'll just start off with my slide share. And I have taken, first and foremost, I have taken Madan's advice and I have made my CV little concise. I hope this is okay, Madan.
Yeah.
Okay, so I'll be talking about teenage pregnancy. I would like to thank Dr. Girish Mane, my brother, friend, philosopher, guide, and Dr. Supriya Jaiswal for sharing their thoughts and their PPTs with me on this topic. Sexual health, cannot be complete without addressing the sexual health of teenagers. And teenage pregnancy is by far the worst circumstances that we can, face as far as adolescent sexual health is concerned. What exactly is a teen pregnancy? Teenage, as we know, from ideally by definition, from the age 13 to 19, that is the teenage. So any lady or girl less than 20 years of age will be called as a teenager. And therefore, a teenage pregnancy is a lady or a woman who is pregnant before the age of 20 years. Now, roughly 1 in 4 teens get pregnant by the age of 20. This is a very appalling number. At 20, if we remember what we were doing, we were still in medical college. We were still busy chasing practicals and journals and theory and practical exams. And we were so naive. We were having a good time with friends. We were hanging out with our friends. We were studying. And at that age, if somebody has to bear the burden of motherhood, I think that's a big, the onus is on society and particularly us as caregivers, so that no girl should have to face such circumstances. The objective of this study are to study the global as well as the Indian scenario, try to find out what are the social determinants or the causes, the effects, and the complications of a teenage pregnancy, and some suggestions about practices that we can, make in preventing teenage pregnancies and moving in the forward direction of avoiding teen pregnancies as far as possible. Now, if we look at the global statistics, 7.3 million girls become pregnant before 18 years of age. That's a huge number, really, really huge number. Across the world, 15 million girls are married before the age of 20. Now, you can imagine in India itself, we come across so many girls who may be more than 18, but immediately at the stroke of midnight when they turn 18, they are married off. And by the time they are 18 and a half or 19-year-old, they're pregnant and they come to us. Many a times they are just not even touched 18 and they come to us with pregnancy, even though it is married. And then we have this big burden of POXO Act standing, on our heads, that what exactly we should do. Here is a married girl. She is married. She is देवा ब्राह्मणाच्या साक्षाने तिने लग्न केले आणि आता ती प्रेग्नंट झाली आहे पण ती 18च्या कमी आहे. And then we have to, go through the whole rigmarole of making a police complaint and so on and so forth. 2.5 million girls aged 15 or younger give birth every year. Can you imagine how much the caregivers, the obstetricians must be facing such a big, burden of treating and delivering these girls. Half of the pregnancy among girls aged 16 to 19 live in the developing regions and are unintended. So these are not pregnancies that are planned. They are unintended, not planned, not thought about. And then suddenly the girl finds herself pregnant. Second highest cause of maternal death. We all have studied this, that each and every complication that can come in pregnancy, one of the biggest predisposing factor is young maternal age. 3 million girls undergo unsafe abortion every year. So many times we get infected cases. They have taken tablets from over the counters, or they have done some dye, kade jaun MTP, and then they come with sepsis, bad sepsis. And often especially if you are in a teaching institute, often we have seen girls who come with, the complete pelvis gone for a toss because of unsafe abortions. This graph, or maybe this chart, more or less shows us what is the incidence of teenage pregnancies in India in the various states. So then overall average is around 6.8%, and 11% of all teenage pregnancies, means global burden, 1/10 are in India. And I think 1/10 is still only the tip of the iceberg, because these are highly underreported. I am sure there are many more teenagers who are getting pregnant, but probably are not coming under the radar of being reported, maybe because they are taking some tablets, abortifacients, or whatever. In India, around 6 to 9 girls, 9% of girls between the age of 15 to 19 get pregnant annually. 1 in 10 young Indian women are already pregnant with their first child before they turn 20. How more horrible can the statistics be? So many times we have seen this in institutes, especially that lady is 25-year-old and she's coming for tubal ligation because she has completed her childbearing. Maybe she has 2 or 3 children, and you are like a 25-year-old resident there, not even married, and you have these women coming and doing tubal ligation in front of you. So you can, how distressing this problem is. 43% are already mothers among young adult women between 20 to 24. So even as they grow a little older, can you imagine 50% have already had children by the time they turn 24? That means graduation age. So you can imagine what must be happening with their studies, with their careers. Nobody is even giving a thought to it. 1 in 5 young adult women between 18 to 25 years have initiated sexual activity before 18, and I'm sure this figure is terribly on the rise. Globally, of course, the rates of pregnancy have fallen more because little by little there is more understanding, there's more awareness and usage of safe contraceptive and safe abortion facilities available. So it's very good and heartening that the rates have started falling. In 2023, a total of 6,73,000 babies were born to women aged less than 18 or 19 years. Young sexually active teens are especially at risk for pregnancy and other negative consequences of sex, like sexually transmitted infections, like sexual abuse. Teen girls who have the first sex below the age of 13 are more likely to have been forced into sex rather than doing it consensually. And especially teen girls with older partners are twice likely to have unwanted sex and more likely to have unprotected sex and consequently getting pregnant. Indian figures, again, around 11% of the Indian population is part of teenage pregnancy group. Now let us look at the important thing. What are the causes and what are the effects? First and foremost, child marriage, which is very rampant in India even now. So we have certain cultural norms. There is no awareness about contraception. There is very poor access to services and information, even to young married couples. How many those who stay in suburban areas, like Madan, like myself, who are practicing in the little peripheral towns, how many times do we get married couples or couples about to get married come to you for contraceptive advice? Most of the time, they either come when they are pregnant to register ANC, or they come for MTP advice. So this is foremost lack of knowledge and our cultural norms which support early pregnancies, early age of marriage. Unprotected sex because of whatever cause. First and foremost, because of sexual activity at a very young age. Secondly, peer pressure. It is stylish to be sexually active. And if one does not, I remember my 12-year-old girl coming and asking me once when she was in school, ki, Mummy, everybody has a boyfriend. Am I abnormal if I don't have a boyfriend? Now, coming from a 12-year-old, I was really shocked. Next is abuse, sexual abuse, very common among the younger age group. They are unable to defend themselves. Sometimes they don't even understand what is happening with them. They are unable to, bring it out to the adults who can make a difference. And probably they just go on bearing the sexual abuse and finally end up with a unwanted pregnancy. And certain norms, like, some communities, they say, no, we are not allowed to practice contraception. So these kind of norms are absolutely going to go against these teenagers. Now, what are the effects? Increasing pregnancy in early years is obviously going to be, number one, is going to be a financial burden for the family, for society. There are going to be higher rates of school dropouts. So the education and future prospects for livelihood are like going to suffer. These girls are going to become emotionally and economically dependent on somebody else, and that is going to further the deprivement that they are going to face throughout their life as women. Among the medical complications, there are plenty which I'm going to talk about, like maternal morbidities, maternal deaths, newborn deaths, neonatal morbidities that can be consequent of a teenage pregnancy. What are the common causes of teenage pregnancy? Of course, obviously, it is unprotected sex. But why does this sexual activity take place in the first place? Lack of information about sexual and reproductive health and reproductive rights is one of the topmost cause of having a teenager get pregnant. Peer pressure, I already mentioned that it is very fashionable to be sexually active, and therefore many a times the young generation gets compelled or feels compelled to have sex prior to marriage. Poverty, poor socioeconomic, it's not that only the poor socioeconomic strata indulge in pregnancy or indulge in sex before teenage, but that they have such limited access to medical facilities. Even worse, knowledge is very lacking, and therefore they tend to get pregnant more often. They tend to continue that pregnancy more often because of a lack of information and lack of access to medical facilities. Media influence, I'm going to talk about, is one more very, very important influencing factor in today's time. Family, I've already talked about the community that they live in, the religious or the community practices that are utilized. Many states, even in now, in spite of making it POCSO Act is active, the Act, Child Marriage Act is active, and in spite of that, early marriages, we all know, we all see women who are getting married even before they complete 18 years of age. Sexual violence amongst partners, from random strangers, from family members, and use of drugs and alcohol, about which one by one I'm going to talk about. Peer pressure, under the influence of peer pressure, children more likely are, prone to drug abuse, substance abuse, and in a state of inebriation, they often indulge in irresponsible sexual behavior. And frequently this occurs because basic information about sex and contraception is lacking. Early marriage and childbearing. Early marriage gives sanctity to the act of sex before the girl completes, her teenage, and therefore we can have adolescent females who are getting pregnant, which are sanctified by society. Lack of information about sexual and reproductive rights. Many of the girls do not even know that they can say no to their boyfriend or to their partner. It is such a taboo topic. Nobody knows about marital rape. No, most people are ignorant about the POCSO Act. So the cultural beliefs that restrict access to contraception in certain cultural backgrounds, that also can be a big hindrance for girls to abort the pregnancy. If at all she is pregnant without her knowledge or without her consent, at least she should have the option of doing a safe abortion. Sexual violence, of course, in India, we are leading in the terms of sexual violence, both against girls and as well as boys. But girls have this, more worse complication of getting pregnant. Often these girls, because of fear of life or whatever reasons, they don't come out with the fact that they are pregnant. Often they present very late in pregnancy, and sometimes after the limit of medical termination, wherein the doctors are so helpless that we are forced to continue this pregnancy. Family, community, and social pressures, the pressure to marry. I am sure all women, especially from medical college, must have faced this. The look that people give you when you are like 25 or 27 and not yet married, and the kind of looks that, oh, not yet married, अजून लग्न नाही झालं, कधी होणार, मुलं कधी जन्माला घालणार, लवकर करा. मग त्यांच्या आईबापांना ज्याप्रमाणे टोमणे मारले जातात. So you can only imagine why women all over around India, especially, there is this, compulsion to get your girl married at as early as possible. Not only that, she is treated as a burden to be gotten rid of. And this will only change once she's given the chance to get education, chance to make her career become economically independent. So these things are really entwined between each other. The social fabric, the medical problems are all really, really entwined. And, as caregivers, I guess at least a little difference we should be able to make, at least where the families are listening to us, or, they come to us, we should make this attempt. I, for one, always, tell girls who come for any other menstrual problem or so, always I encourage their mothers, you please allow your daughter to go ahead in education, allow her to graduate, postgraduate, take a profession of her choice. Whether she pursues a career or not is secondary, but please make her capable of earning her living if the conditions so require. Poverty, poor socioeconomic status is one of the biggest killers in our country, especially because of lack of information, lack of access to healthcare, lack of safe abortion and contraceptive facility. It's not always the lack of facility, but it is the access that the facility, whether it is accessible to the girls or no. That is one of the important question, because for them, often going to an hospital and having to pay maybe even 100 or 200 rupees fee may be a big burden for them. And seeing the crowd that comes to medical teaching hospitals, a young unmarried girl may not find it comfortable to go to such a place. Also, there may be problem in parent child relationship. Poverty can lead to deprivation. This can push young people to perform survival sex. That means they perform sex in exchange for money or food, or simple things that they need for their day-to-day living. Use of drugs and alcohol, one of the biggest killers in this age group, because of peer pressure, because of rave parties, and it's just so happening to drink alcohol and smoke. And all these drug abuse, the substance abuse, leads to inebriated condition wherein the teenager is not able to make logical or sensible decisions. And that is when they often engage in unprotected sexual activity, exposing them not only to a pregnancy but also to STIs. Media influence, I said I'm going to talk about this. Media has a huge effect on teen pregnancies. There are shows which actually glorify teen pregnancy, like Teen Mom or 16 and Pregnant. Now, these shows glamorize pregnancy and make a scenario where it is okay to be pregnant at 16. So this can actually encourage teenagers to be more careless and get pregnant more often, because they are not seeing the hardships that motherhood carries. These shows don't focus on the maternal deaths that occur, on the antenatal complications that occur, and therefore these shows can actually influence younger girls to be more careless and become pregnant. Exposure to suggestive or explicit media, films, magazines, music, pornography influence adolescent sexual behavior to a large extent, and they can engage especially in casual sex before they are physically or mentally ready for it. Impact on health, there it is, the physical, the mental, the emotional impacts are going to be huge, obviously. First and foremost, the medical problems, that they are more likely for sexually transmitted illnesses. In case they get pregnant, they are going to have insufficient prenatal care because they are scared to go and report these pregnancies. They don't want to reveal to their parents. So often the first or the second trimester will go without any care being given to them. They are more prone to PIH, anemia, diabetes, all complications that can be thought of in the antenatal period. A young mother is going to be more prone to these. Postpartum bleeding, postpartum death, and postpartum depression can be one of the important aspects. There can be feeling of loneliness, isolation, because obviously she's going to become a social outcast once she gives her delivered as a single mother, especially in a conservative society like ours. So there are going to be social consequences related not only to her, but to the baby also, and therefore a great emotional and mental health issue for both the baby and the mother. STIs, prenatal care. Now this is the time of pregnancy, in the especially first trimester, when we want to identify all the risks, investigate her and get her duly treated. But these are the teens who are going to be not getting adequate ANC care because they're probably scared of reporting this pregnancy, and therefore this is good ANC facility which can identify medical problems, treat the baby and mother, monitor the baby's growth, and help deal with the complication are all going to be precariously missing, and therefore these girls are more likely to land up with complications. One of the commonest complications of young mothers is premature birth. So pregnant teens are more likely to give birth to premature babies. They are more likely to substance abuse or tobacco or alcohol or some such substances, which can again lead to premature birth. Baby born to teen mothers are at a higher risk of medical problems like low birth weight. They are more, the younger the mother is, the more chance that this baby will die during birth or during the first year of life. The babies of teen mothers are more likely to have disabilities due to prematurity, experiencing respiratory, digestive, cognitive, and other problems. And children of teen mothers, in turn, are going to live a life of poverty, more likely to be school dropouts, and become teen parents themselves. Especially in the Western countries, this is a very rampant problem. PIH, eclampsia, preeclampsia, severe anemia, all these are the younger the mother in age, the more she is predisposed to all these conditions. Medications that are needed to be given may have their side effects, and non-compliance on part of the teenagers because of their age and emotional immaturity again can pose a very big problem. They are more prone to anemia because of dietary issues. They are not eating well. They're trying to hide their pregnancy. They don't want to gain weight because people might diagnose that they are pregnant. They will not go to doctors, so they are not taking any iron supplementation, and therefore anemia is bound to be present in these girls. Postpartum depression after delivering the baby, she probably, having been through the process of labor, and then maybe it actually dawns on her that now it's a huge responsibility to bring up an infant, and that can lead to a depressed mother who is unable to look after herself as well as the baby. Social consequences, lower access to higher education, higher divorce rates, premature death of women, uncontrolled population growth, weak and unhealthy children, and single motherhood are one of the biggest negative consequences of teenage pregnancy. Emotional and mental health problems, of course, are going to be there. We have a 13, 14, 15-year-old who is now a mother who is unable to even take care of herself. And now she has the burden of looking after another baby or another human being. You can only imagine what kind of issues she's going through. Not only the child or the teenager, the parents are also going to suffer. The parents are first going to experience shock. Often they will deny. There is disappointment, anxiety, anger, sometimes a sense of guilt that, oh, I was more careless and therefore my daughter landed up with this problem. They probably have this disillusionment about whatever dreams they had for their daughter. Ki, oh, she will become a doctor, an engineer, a lawyer. And now here is the daughter who is pregnant, who is not going to be accepted by society, and who probably, faces social death as such. Also, the fear parents can, because of the fear of the parents' reactions, the girl may not come out with the pregnancy until it is too late. There may be concerns about what the family or the rest of the family or the friends think, and therefore decisions sometimes go wrong. So these parents are more likely to take their children or their girls to, dais or unqualified doctors where the law or the too much of social recognition is not there, in some remote corner, and get them either aborted or delivered. Now, having said all this, how can we prevent? Please do tell me when my time is up, because teenage pregnancy, you can just go on and on. Maybe in next 10 minutes, I'll wind up. So in as far as prevention, now this is where we as caregivers come in handy. Promoting abstinence, it is easier said than done. But whenever many of us are doing school health programs, we visit schools, colleges, and give information about sexuality, about menstruation, about hygiene. We must take a time out to talk about, number one, about sex. If we as caregivers are embarrassed, then I don't know who else can help them. So we should overcome our own judgmental natures, our own fears, and come openly to talk with youngsters, promote abstinence, tell them the advantages of keeping yourself reserved for that one special person, the power of being a moral person in life, taking birth control very seriously, Offer the various options of birth control to them. Don't perjure yourself into thinking, oh, I live in this town and this town is so conservative. इथे कोणी लहान मुलं sex करत नाहीत. We are absolutely fooling ourselves. Instead, it is better that we accept it and explain to the children what are the birth control options, what are the options for safe sex, educating them about various contraceptive techniques, and that sex, especially if it is unplanned and unprotected, it will come at a price. Positive communication between parents and children helps establish good moral values, encourage from abstaining from sexual activities, perception of peer norms. It is very important at such times to set a dialogue with the children, to explain to them that what their peers are doing need not be the correct thing. It is okay to say no to sex. It is okay to say no to drugs, to avoid company which forces them into doing this high risk kind of behavior. Increase their perception of HIV, STDs. We have to explain that HIV has no treatment and that prevention is the only risk. If they are sexually active, it is advisable to talk to them and their parents and give them advice about birth control. Teenagers should be exposed to more information, the more right information. They are already given more information, the wrong one. It is time we as caregivers give the right information to them as much as possible, as various ways as possible. Amogs, we know, is doing a great job. We have podcasts, we have videos, we have Facebook live shows, and wherein we give access to such information. And different birth control methods should be made easily available and easy access. When we talk about easy access, condoms are freely available in government institute. But can you imagine a 15-year-old or a 17-year-old walking into a medical college or a teaching hospital and asking for condoms? It is not possible. We have to make it more friendly for them. It has to be done in such a way that they don't feel intimidated to get access to these kind of services. Socio-economic deprivation, if we can alleviate it, it is a topic for discussion on a different platform, but it is also equally important because poverty and lack of education plays one of the most important role in teenage pregnancy. Sexuality education, we have Dr. Jumani, who is a pioneer in this kind of sexual education. We have Madan, who is taking it forward. So this this aims at young people, to make young people like and respect themselves, develop a sense of identity. It helps learners to see sexuality as a natural and positive part of life, teach skills to make informed and responsible decisions, and explore different values and attitudes. Attitudes of celibacy, values of morality are new to them, but it is time we introduce these things to them. They are exposed to social media, where in one serial, one man is marrying 3 women and one woman is divorcing 3 husbands. So when we are talking in such a scenario, it is up to us to introduce the concept of morality and celibacy to them. Protective factors, already I've spoken about. The role of condoms is huge, not only as a preventive for pregnancy, but also as a prevention from infection. Although we must tell them that condoms has a higher rate of failure, and that if they are seriously interested in family, in contraception, they should also practice some other form in addition to condoms, like maybe OC pills.
Excuse me.
Yes.
Yeah, time is up now.
Yeah. This
please.
is my last slide.
Yeah.
Promote proper antenatal, prenatal care. Of course, as doctors, we will be doing that. And when we talk to our children, we should also mention that in case you do land up with a pregnancy, please get access to the correct people. Don't go to shady places to get that pregnancy aborted. Go to your doctor, consult your gynecologist, go to the medical school near you, medical college or teaching hospital near you, so that we can boast very soon of a time where teenage pregnancies are non-existent. And if they are well planned and thought about pregnancies. Only then we will consider that our job is done. Till then, I think it's a work in progress. So once again, thank you, Madan and Monica and entire team of Amogs and IMA. Thanks to my brother Girish and Dr. Supriya Jaiswal for helping me with the slides. And thank you to the chairpersons. Over to you, Meenakshi. And I think Dr. Kiran is also here.
Hello. Very nicely presented, madam. I just want to add one thing. Uh, According to recent advances in POXO with MTP, Government of Maharashtra issued guidelines for termination of pregnancy in minor girls. They said there is not necessary to disclose name of minor if minor and guardian are ready to not to disclose the name. In that case, police will ask the name of the patient, and they also not ask for the POC. But reporting is compulsory.
Correct.
So this will help the obstetricians from the Maharashtra, so they can do MTP in POXO case just by sending secret letter to the police without disclosing name of the patient.
Yes, very right.
There is one
Actually,
more. It is
POXO
a
in
very
itself is a
recent.
huge discussion, so I stayed out of it because that itself is a big talk in itself.
No, that is a very welcome move by Maharashtra
Yeah,
government.
yeah,
In the
really,
recent
really. And thanks for bringing
guidelines.
it to our notice. Yeah.
And one more thing is that even if you don't have to know you should take a written denial consent. That is called as a denial consent, that the person and the parents don't want any action to be taken by the doctors or the police. So that is a separate form given in the Maharashtra government that document. It's a document of about 68 pages. So you can download that. It is there on the site, and you can get a denial consent. It is a person's and the parents denial, which is very much important, and that record you have to keep.
Okay.
Thank you. Thank you, ma'am.
Thank you.
Yeah.
Thank you so much, ma'am. I request Dr. Madan to please take over for the next session now.
Now moving to the last session, that is the sexual health role of an OBGYN specialist, none other than by Dr. K.S. Jayarani Kamraj, madam. I I welcome the chairperson for this session, Dr. Swapnanjali Award, and Dr. Sneha Bhoyar, ma'am. I think Dr. Sneha Bhoyar, madam, is not there. Just a minute. Yes, Dr. Swapnanjali Award, madam, is director of at Dr. Award Maternity Home. She is chairman of Women's Doctors Wing, IMA Maharashtra. She is very active member of IMA, past president of IMA Nasik Road, and she is a faculty at various national conferences, and she has so many awards in her name. I welcome Dr. Swapnanjali Award, madam. And I think Dr. Sneha Boyar, madam, is not there. I request Dr. Swapnanjali, madam, to introduce our speaker. Yes, over to you.
Thank you, Dr. Madan Kamre, sir, for welcoming me for such a kind intro. And it's an honor to be here as a chairperson for this much needed awareness webinar. I would like to introduce well-known doctor, Dr. K.S. Jayarani Kamaraj, madam. She is the Joint Secretary at TNFOG, President OGSSI 2023. She is Vice President at Tapisar. She is South Zone Coordinator, FOXY, for the No to Violence Against Women Committee. She is Associate Secretary, World Association of Sexual Health, Advisory Council member for the World Association for the Sexual Health. She is also the member Board of Studies, Dr. MGR Medical University, and Secretary to the Indian Association for Sexology.
Thank you.
And many awards. I welcome you, ma'am, and looking forward to a very nice, wonderful talk from you. Over to you, ma'am.
Yeah. Welcome, ma'am.
Thank you, Swapnanjali. Thank you, Madan and Monica, for this wonderful webinar, and a very special thanks to Kiran sir and Pandit sir being the office bearers of the Amogs and also the IMA office bearers, for giving me this opportunity to join with you virtually for this interesting webinar. Well curated by Amogs Sexual Medicine Committee and IMA Maharashtra. And I'm very honored to be here to share a few thoughts on the sexual health from the OBGYN point of view. Uh-oh. So can I? Uh-oh. Yes. Can you see my presentation?
Yes, ma'am, visible.
Yeah. Is it on full screen, sir?
Yes, it's full screen.
Okay. So very special thanks to everyone. And we'll be now talking for another next 15 minutes about a very important factor, that is the sexual health in the what is the role of the OBGYNs. So far we were seeing about the Deepak sir talking very nicely about the counseling and also how to take the history and how to do the counseling. And very interestingly, we had about, is my slides are moving? Yeah.
No, madam, slide is not
Yeah.
moving.
So
Yeah.
now we will be seeing on a very important aspects, what is the role of the OBGYN specialist in the sexual health, which is very important. We know pretty well the sexual health and wellness experts all over the world says that a satisfying sex life can positively impact your overall health and well-being. We know sexual health is very important part of the any human health, but also has a positive impact on the overall health and the well-being. And when you look into the women's sexual wellness and the well-being, it is always a very much often overlooked one. Though many of the studies says 40% of women will experience some type of sexual problem over the course of their lifetime, but still only a few will be coming to the scenario of treatment. So being so common, still only a very few women take care of their healthcare providers for the treatment and for the sexual well-being. In addition, the self-care providers may not be fully address all the aspects of the female sexuality, which is very, very important. Why it is happening? We know pretty well, still sex is a taboo topic in our country, and that is a very important reason why most people fail to talk about it. Even the patients or even the doctors or even the gynecologists or any section of the medical fraternity, they always have a sideline to talk about the sexual health and the sexual wellness. So that's why we are here to talk about the sexual health, what we as OBGYNs can talk about it, how we can discuss, how we can correct, what are all our scenario, because we are dealing with the organs of the sex, mostly the vagina, the vulva, the clitoris, every part what we see as the sexual organs is in our platter. So it is our responsibility as a practicing person to look into the women's need, where most of the women suffer through this silent problem, which they never come out in their talk or in the, any of their discussions to the doctors. So very importantly, we are liable to talk about the good sexual and the reproductive health, because many times we talk about the reproductive health, but we never look into the good sexual and the reproductive health, which are very important for the women's well-being. Though we are looking into the fertility, the pregnancy and the delivery, but also we are not looking into the sexuality as a whole. And all the more we are looking more about the contraception and the pregnancy, unplanned pregnancy, everything. But we always should look into the healthy aspects of the sexual life that may create a very important, healthy and the respectful relationship in the couples. And thereby they have a very safe, appropriate, and also a very important aspects in their sexual life. So we know pretty well almost most of the physical and the mental health issues are connected with the sexual health. And that is why the definition says that sexual health is inextricably bound to physical and mental health, Just as physical and the mental health problems can contribute to sexual dysfunction and disease, those dysfunctions and disease can contribute to the physical and mental health problems. So they are always very much interconnected with every physical and every mental problems has a sexual issues underlying. So always we have to think of the sexual health when we come across any disease or any problems, when we come across into any type of practice. It could be a medical problem, or it could be a surgical problem, or it could be even a gynec issues, or it could be any problem related to any of a system which definitely have an impact in her sexual life. So definitely sexual health is complex. The complexities is always into many conditions. For the men, the sildenafil has thrown a major focus and caused a lot of improvement in their sexual dysfunctions, especially the erectile dysfunction. But for a female sexual dysfunction, however, there has been found to be, though it may be found more prevalent, but it is very difficult to define, and it has a more complexity to treat. And also it has a very important complexities which may lead to a lot of issues related to the women's sexual health. So where are we as a gynecologist? Are we doing enough to the sexual issues what the women of our folk encounter? That is the main question. So we OBGYNs are the very women-favored healthcare professionals, because when we are talking about sexuality, we have to think of the women's sexuality every day in their offices, in their life, in their home, everywhere. So reproductive health also encompasses the women having a safe and satisfying sexual life, and that are capable of their reproduction and as their wishes. So as a gynecologist, we definitely have to improve the quality of the women's reproductive and sexual health, which we have to be our main responsibility. So the women also expectations that the doctors in the past, there have been a lot of changes in the women's expectations in the present scenario. What they were seeing the doctors in the past is different, but now the women's expectation as a gynecologist as well as the doctors in relation to the sexual issues are very complex. They are really now coming out with their problem. So many women associate the sexual problems with many of their physical problems and expect their gynecologist will be the knowledgeable about these problems and are they're very comfortable to talk about it. So in that way, they come through this problem and they put forth this problem very much into the gynecologist to get the solution. But very interestingly, many times the discussion between the doctors and the patients are very much intricate with lot of issues, because many times we doctors, we always feel that we have an inadequate knowledge in the field of sexuality, and probably the concern of false allegation, especially for a male gynecologist, when they want to talk about the sexual issues to the women or into the female patients, they always feels that false allegations of an inappropriate behavior may be a cause. This can be the confusions which leads to many a times the doctor's own attitude towards dealing with issues and making them more discomfort and reluctant to discuss these sexuality issues. So many societies still consider sex as a taboo, and we gynecologists are also part of that same society. So talking about sex may be difficult for both the doctor as well as to the patient. So we need to have a comfort as well as a confidence in discussing and treating the sexual health issues. So sexual dysfunctions were regarded in the past as the manifestation of a disordered psychology. Many times in the past, whenever a couple come with a sexual dysfunction, we always cause it's a psychological problem. It is a problem that they feel because of the emotions. That's how we look into it. But nowadays, there is always, we think that it can be an underlying problem, not only the psychological problem, but also some problem which is underlying, which can manifest as a sexual dysfunction. And sexual dysfunction itself can cause a lot of problem in the emotional disturbances. So we have to think of this, any problem related to the sexual issues, and should have a proper care from the gynecological point of view, which needs a proper corrective treatment. So sexual problems can originate from the multiple organ systems, because we are dealing into the pelvis, which has a limited space, occupied many organs like bladder, rectum, uterus, ovaries, everything. So even any cause of a deep dyspareunia or a sexual pain can be due to very many conditions, like even from the interstitial cystitis, endometriosis, even an adnexal pathology, or even a short vagina, and the pelvic floor hypertonicity. Many a times it is a post-surgical scarring, and also pelvic congestion, even a constipation, all may have a problem of a deep dyspareunia. So not only the uterine problem or the adenomyosis, but very many conditions can cause a deep dyspareunia. So very much there can be an underlying pathology which needs to be properly assessed, and definitely treating them properly can clear the sexual issues well in these women. So when you look into the sexual concerns, it is almost 75 to 30, it is always all the sexual domains, especially the desire, arousal, and orgasmic dysfunction, they're always 2 to 3 times greater in the women with medical conditions like diabetes. And if you look into the hypertension, they are almost twice, they are more prone to develop sexual dysfunction when compared with the normal women. So all the medical conditions, which could be due to the conditions as well as the treatment, the medications, all may cause sexual concerns. So all the problems can be imposing a sexuality related problem. And when you look into our gynec issues like childbirth, postpartum, menopause, definitely have an impact on the women's sexuality. Women have a lot of problems related to the desire, arousal, orgasmic experience that may induce a lot of concerns in their normal sexual life, and also that may cause a very many sexual pain disorders, especially the dyspareunia and vaginismus. So the biosocial model, or the biological, psychological, interpersonal, cultural factors, in addition to the organic causes, can cause a lot of problems related to the sexual disorders. So gynecologist is definitely an important person in managing their sexual concerns, because we deal with most of the hormones related to the hypothalamus, thalamus, pituitary, everywhere. And if you look into the sexual issues, the limbic system, which has the greatest connection with the hypothalamus, thalamus, and the frontal cortex, is core to the normal sexual functions. And sexual desire is initiated in the brain, which has been primed with sex steroids, mostly the androgens, as estrogens, and the progesterones, which are the hormones that we look into our daily practice. So these hormones play a major role in connection with the sexual functions. So knowledge of different hormonal functions, the medical and the social relationship issues, addressing to the social cultural issues, may greatly help in managing these complex issues. The medical skills of a gynecologist uses to manage this general health illness, which play a very important role in managing the sexual concerns. So definitely medical and the surgical disease and their treatment definitely is needed, because they are all the basic causes of the sexual dysfunction. So many studies have undertaken to know the attitude, the comfort of an obstetrician and gynecologist to address these problems and the measures to improve it. A study published in 2020 says that the primary care physician, the gynecologist, or the important physicians who has to take care of this sexual dysfunction in the women. But the incidence was found to be lower in the gynecologists when compared with the primary care physicians. That is an interesting study. Another study states that 7.9% of the respondents routinely export sexual issues with more than 80% of their patients, mostly doing infertility practice. The rest of the gynecologists, they never look into the sexual part of any women's life. So that is a very important one. Only the fertility specialists talk about sex to their patients, but other gynecologists, they never talk about the sexual issues. Another study found that only 1/3 of the patients has ever asked about their sexual life by a gynecologist, while almost 80% of the respondents reported that they would like to be asked about and discuss about the sexual issues. The patients mostly did not complain because of psycho-emotional barriers, and the shame was the main barriers for the patients to talk about to their problems. But if the doctors open up, if the gynecologists open up the issues, they are very happy to respond to their issues, so that they find a very important confidence and to talk and discuss about these issues. So many a times it is our fault that not to open this to the patients who need a definite care. So how we as a gynecologist help in their dysfunctions? Because if you know, the various factors causing the sexual dysfunctions are mostly either a hormonal imbalance or a vaginal pain due to some conditions related to the pelvis, or a urinary incontinence related to the bladder, or a prolapse, or even a pelvic disorder, or an emotional issues like anxiety, tension, relationship issues, and many times the negative body image and the drugs which they are using, all these things are the causative factors of the sexual dysfunction. So we as a gynecologist, we look into all these issues when you come across any such problems. And definitely when you look into the physiology, experiences, emotions, beliefs, lifestyles, and relationship have a role in the sexual response. Many times the sexual drive, arousal, and all the pleasure can be affected if any of the sexual domain gets affected. And it is all interlinked and interconnected, thereby causing a lot of sexual dysfunction in relation to sexual drive, or the low libido, or arousal problem, orgasmic dysfunction, or it could lead to sexual pain disorder. So definitely the sexual domains being affected by most of this physiology, especially the hormones, emotions, and lifestyle, all this causes all the sexual issues which are really very important. And when we take into the each stages of a woman's life, like especially the adolescence, where we gynae play a role, as rightly pointed out by Supriya, a very important one is the sexuality education. So we as a gynecologist should be a part of this comprehensive sexuality education by counseling, by providing the service to the adolescent patients. We have to serve the parents and the communities by helping them to create an awareness about the evidence-based curricula that clear their focus on the health goals, that is the prevention of teen pregnancy, STI, including HIV, and also we have to help them to provide a health care that focuses on optimizing their sexual and reproductive health development, including education about and also about the vaccines. So these are all very important role that we can play in the adolescent sexual health. And very importantly, when you look into the community awareness challenges, we have an important resource for the sexuality education, because we can encourage the patients to encourage in the positive behaviors to achieve their health goals and discourage the unhealthy relationship and behaviors that put the adolescent at risk of pregnancy and STIs. And we can also evaluate the adolescent levels of engagement in risky behavior, including those occurring online, the child educated patients, as well as the risk of the social media, internet. I think all these things have been well talked by Supriya. And these are all the responsibility of the gynecologists, so that we can talk about the prevention of STI, prevention of teen pregnancy, and also help them to provide a HPV vaccine. All these things play a very important role, especially in the adolescence. In the reproductive years, we have all the problem related to the sexual well-being, especially painful intercourse, difficulty in reaching orgasm, troubles in being aroused, heavy periods causing very less days to have their sexual life, pelvic pain, urinary incontinence, and hormonal imbalance, including PCOS and STIs. So these are all the commonest health conditions which we look into our clinical practice every day, which also play a very important role in the sexual health. So we should be aware of each conditions and how we are going to manage them, which are very important. Maybe a simple lifestyle modifications like exercise, mental therapy, or some medications which can improve their sexual functions can play a very important role. And very interestingly, the HRT for the menopausal women, as well as an O shot or a P shot, which can help them to improve their sexual functions, can be well practiced by an OBGYN when they come across any of the sexual dysfunctions in the women. And next, a very important part that we come across in the women's life is the menopause, where most of the sexual dysfunctions being encountered. Because many times these women feel that whether I can have a sexual life after menopause, can I be well satisfying my husband? Can I get my orgasm? Whether my partner intimacy will be lost, whether I'll have the low desire or it will be the end. All these things make her go in for a stress, because many times the perimenopausal symptoms of the changing hormones definitely have an impact in their sexual life, which causes a sexual dryness, vaginal dryness, tightness, irritation, less clitoral sensitivity, decreased libido, and pain during sex. And many times they lost interest in sex mainly because of difficulty in sleeping, the pain, discomfort, headache, hot flashes. All these things have a major impact on the sexual health in the menopause. So you as a gynecologist should be aware of this, and we have to help them in their journey to recreate a balance and discovering the new beginnings in their relationship within themselves. So we can give them a very important part how they can improve in their transition, how they can help in their sexual life in this journey, which is very important, because many times they may be symptomatic, they may be asymptomatic, sometimes they may be symptomatic, but they may not come out with a problem. So definitely you have to address this when you come across any menopausal women. Ask for them, how is their sexual life? How is their intimacy? Have they feel anything low about their sexual desire? Anything about their intimacy? And how about the vaginal dryness? And how the urinary incontinence? All these things are very important, have a role in their sexual health. And all the women has to be counseled about the vaginal dryness, because many a times the women doesn't know how to express it, but we should give them with a solution. Definitely, like your skin, your vagina needs a lubrication. It is always better to use a lubricants. It is more that you can use a silicone based lubricants which can last longer than other types of water soluble one, and they are less allergic. That will help them to have a better lubrication. Better prescribe them a estrogen cream that will help them to improve their vaginal cellularity, and thereby the lubrication will act both together. They can have a pleasurable sexual life. And definitely the most of the women's question, how can I satisfy my husband after menopause? And you have to address them with the help of about talking about the wetness, using of the moisture, and many times we can give them a suggestion of the medications, and even about the pelvic floor laxity. You can advise them pelvic floor therapy, as well as exercise, yoga, and uses of vibrating therapy, and even a lot about the foreplay. And importantly, we have to give them a HRT when you feel the vaginal atrophy is a very important issue, because definitely the estrogen improvement will cause a very improved way in their vaginal lubrication. And vulvovaginal atrophy can be treated with either a HRT, which can be in the form of a pill or in the form of patches or in the form of a vaginal cream, all having a goal to improve their therapy. And definitely orgasmic problem, which is very common in the menopause, you have to ask for their sex drive, you have to ask for their sexual pleasure, and definitely they can be helped with a lot of awareness, with a lot of suggestions about their changing their sexual routine, focusing more on the foreplay, incorporating sex toys and vibrators that may help them to improve their orgasm as well as improve in their sexuality, and help them to improve their pelvic pelvic floor laxity or a pelvic floor relaxation exercise, and couple counseling. Always those are all very important. Even there are a lot of psychological therapies like mindfulness therapy. It can be done with an acupuncture, yoga, and can be do by a CBT therapies. All this will help them in the mind-body activities, which will help them to relieve the symptoms and can improve their sexual intimacy, desire, and even improve their sleep quality, especially in the menopause. We can use even the FDA approved only drug, which is the flubanserin, can be used when they have a hypoactive desire disorder. And we can use testosterone, which can be given as a transdermal testosterone product, which can be given them to improve their sexual desire. And many times the supplements to increase the libido, maybe a soy or a red clover, can help to improve them. So these are all some simple suggestions that as a OBGYNs, we must know when you encounter an adolescence with a sexuality difficulty. We have to educate them, as well as the middle-aged women when they have a lot of issues related to the sexual issues, and the menopausal women when they come with some menopausal symptoms. Ask about the sexual life, and that will help them to get into the mostly confidence with this gynecologist. That will help them to improve their quality of life as well as their relationship with their husband. So remember, sexual wellness is an important part of women's health. Menopause is a journey of recreating balance and discovering new beginnings in the relationship within yourself. And it is always very important the time to rejuvenate your partners, and also you have to rejuvenate with your OBGYN. So we must be very happy to talk about it as well as open the conversation with the patient. And definitely sexual wellness, all the OBGYNs, we must be aware that we have to tell them, make the patient feel comfortable, ask them about their embarrassing difficulties, put a leading question in their clinical consultation, and that's why you can have a real supportive care for the FST affected women in their all stages of life. So all OBGYNs, we are there to understand, help, and to take care of the need, which is very important to the present and in the future. So we should take responsibility to talk about this issue, and that will help them to give us simple solutions, and that may take on your practice as well as your care of the need in the sexual health. With this word, I thank you one and all for the patient listening, and I'm open to any questions too. Thank you so much. Thank you, Madan. Thank you, Monica, for this opportunity, and thank you, chairpersons.
Yes. Thank you, ma'am, for your fantastic guidance for OBGYNs. Over to you, Swapnanjali, ma'am, for your inputs.
Ma'am, first of all, congratulations. You have excellently presented and elaborated such a sensitive and complex topic in a very concise way, a much needed initiative, I would say, that each and every one of us, we should talk about this, ask leading questions. That was a very good advice. And definitely we should ask this for anything they come to us. Because many a time these are the hidden questions which they don't want to address themselves, but we can extract from them. On the behalf of IMA Maharashtra State, I'm thankful to the team Amogs for conducting this webinar and being conferred upon the responsibility as the chairperson, as the chairman of the Women Doctor Wing, IMA Maharashtra State. I would request team Amogs and the organizing committee as well to conduct more such activities in collaboration so that we can work more and do more for the women out there and for the families too. So thank you. And finally, thank you, Dr. Madan Kamble, sir. You have flawlessly conducted the webinar, and all the best, all the good wishes for the next webinars as well. Thank you.
Yes. Thank you, Swapnanjali, ma'am. We will be working in future too. Thank you for joining. Is there TSS Rao, sir? Rao, sir, are you there? I think he is left.
He is not around.
He was there. Okay.
Yes.
Let us conclude the session now. On behalf of Amogs Sexual Health Committee and IMA Maharashtra State, I would like to extend my sincere thanks to all the Amogs office bearers, IMA MS office bearers, Chief Guest, Dr. Kiran sir, Santosh sir, our guest of honors, Dr. Anil Awar sir, and Dr. Santosh Kulkarni sir, my co-convener, Monica, and all the speakers, and all the respected and esteemed chairpersons for these sessions. I congratulate all the chairperson, Dr. Jumani sir, Supriya ma'am, and Jairani ma'am. They were fantastic talks, fantastic talks. People enjoyed very well. I also thank Dr. Ravindra Kute sir, past president of IMA Maharashtra, for joining. And all the dignitaries joined today. Thank you once again. Thank you, Anil Awar sir. Thank you, Monica.
Thank you, Dr. Madan, for involving all of us and getting us on the same platform to share our views. And it's an excellent work that you are doing under the committee of FMC committee for Amogs.
Yes, sir.
Hope to see the IMA branch opening very soon.
Yeah.
At
Zali. Yes.
Dr. Madan sir, it was a wonderful program.
Thank you, sir. Thank you.
Congratulations, Madan and Dr. Monica, madam.
Thank you,
Yes.
Santosh sir, for being there till the end of the program. And it's a constant source of encouragement that all the seniors give us.
Yes, thank you. Thank you.
छान टॉपिक होते मस्त झाले एकदम सर्वांनीच अगदी Yes.
Thank you so much.
Yeah.
Thank you once again.
Good night,
and
everyone.
Yeah, good night. Yeah. So link is shared. YouTube link is shared on the group.
Okay.
Yes, all IM groups. Yeah. Thank you, sir.